Hello, everyone. Welcome back to St. Louis Teens. I'm here today with Dr. ZInser, and we have an important update on the coronavirus situation. Um, Dr. ZInser, since we spoke last Saturday, things have changed drastically, I think, and there have been many new recorded cases. And so, what should people's sort of outlook be on the coronavirus situation at this moment?
So, as of last Saturday, the curve of the number of new cases was relatively flat.
Okay.
But starting on Monday, the number of new diagnoses has increased on a curve that is logarithmic. And so public health measures are much higher priority than they were a week ago.
Okay.
It is being spread in the community,
Okay.
and we still don't have large scale testing. Doctors have many cases that they
Yeah.
would like to test,
Yeah.
but we weren't able to get all of that volume yet at this point. The hospital systems are moving as quickly as they can in that direction, but it takes some time. The number of cases now is fitting the pattern of more wide-scale community spread in the following way.
Okay.
The average number of days from being exposed to the virus to having symptoms is 5 to 7 days.
Okay.
The state has been using a range of 4 to 14 days, and there are reports from 2 to 21 days.
Okay.
But the average does appear to be 5 to 7 days. Each person who gets the virus then typically spreads it to 2 to 3 other people.
Right.
If there are 1,000 cases today, in another 6 days, we would expect there to be 2 to 3,000 cases.
Okay.
Another 6 days after that, at least 4 to 6,000 cases, if not many more.
And I think that, sort of on that topic, I think, it's being said that a majority of people still show no symptoms necessarily, or, are just the virus is very mild for them. So, when should people be getting tested, if they should at all? Because you talked about sort of the limited number of testing available. So, at what point should someone be considering to go get themselves tested for the virus?
If they have, certainly if they've been in contact with someone who's been diagnosed, even if they've been in contact with someone who's been in contact with someone,
Okay.
and they have symptoms of cough, shortness of breath, and fever, and the time course fits the exposure of we'll say 4 to 14 days,
Right.
their exposure to someone who was symptomatic, even if the person who they've been exposed to been in contact with a diagnosed case. So the truth is, more the more people than that really should be tested at this point.
Okay.
People who had much travel in the U.S. In the last week or 2 weeks, and has symptoms, they might be considering it.
Right.
But unfortunately, we don't have the capacity to do that testing yet. I know that Mercy is opening a drive-through screening clinic today, but before going there, I would recommend that you go to the Mercy website to find out how exactly that works.
Yeah.
So we are still waiting on broader scale testing. We are told that it's going to happen hopefully within the week.
Okay.
But for a few weeks now, we've been thinking that maybe it will be next week, and we still don't have it.
Right. And sort of, talking about and looking forward into this week, a lot of schools in the St. Louis area are actually on spring break. And so they're actually mostly limited to their homes anyway. I think that a lot of travel plans have been canceled. So, how would this sort of... Sorry about that. So, how would this sort of have an effect on, how the virus is spreading and whatnot?
So, China gained control of the virus in a matter of weeks,
right,
with police and military enforcement,
right,
social distancing, and quarantining. In Italy, they've had less success at this point that way, although they are hoping to be moving in the right direction. But authority in Italy said that they've had problems with people breaking their quarantine because people in the West have more freedoms.
Yeah.
They in Wuhan, there are actually cameras that track people on the street.
Really?
So there's a big difference. This is requiring that people take the initiative themselves, and that that groups of people take the initiative. The risk of it spreading quickly is that the numbers will peak rapidly, and with those high numbers, the medical system doesn't have the capacity for ventilators and hospital beds to treat everyone who would need it. And if it rose rapidly, there could be thousands of people die because there simply aren't enough respirators. If it rises much more slowly, the peak will be lower, and then the crisis will be able to be managed. The social distancing and isolation will keep a symptomatic person or even an asymptomatic person from spreading the virus to many fewer people than they would otherwise. As of today, regardless of what we do, the numbers will be much higher in a week because people who don't know they have the virus,
Right.
have already spread.
Yeah. Um, and I think that, looking forward now is what can people be doing if someone within their household actually has the virus?
So if someone in their household is diagnosed, then that person is supposed to stay in a separate room uh, and uh, limit their contact with the rest of the family. When contact is necessary, people should stay 6 feet away from one another, and the ill person should wear a surgical mask so that they limit the amount of droplets they spread into the air.
And is there any advice that you would give for households that um,
So those people need to be especially kept at distance from social gatherings. So they shouldn't go to public events. They should limit being out of their house as much as possible at this point.
right. And sort of the last thing is, looking at the current school situation, I know that there are already some states that have shut down schools for a little bit. In Missouri, at least, it's still a local decision. So, what is the sort of outlook for schools and students, and what recommendation would you make to schools in order to, while keeping the best interests of the students in mind, making sure that, the virus is contained?
So that's a decision that schools and the state make in coordination with the Department of Health. And the Department of Health has more information than other people.
Okay.
But based on the fact that we know that the amount of spread and the speed of the spread is based on social distancing, and the fact that we know we are already in a logarithmically increasing situation. The more limitation that is placed now, the better we will be off in 3 or 4 weeks.
All right. And then, is there any other advice that you would offer, teens within the St. Louis area?
Wash your hands frequently. If you're not feeling well, don't go to school. Don't go see your friends. Don't go out in public. Make sure that you are safe for your friends and your peers before you do something like that.
Well, all right. Thank you so much, Dr. ZInser, for your time and answering, all of these questions.
All right. Thank you very much.
All right.